New York State lawmakers held a virtual forum today on the effects the coronavirus has had on those with intellectual and developmental disabilities. News Channel 34's Karina Capabianca has more on some of the frustrations those in the community are facing.
Over the past weeks, all of us have heard from our constituents about the disproportionate impact of the COVID-19 pandemic on the groups served by the OPWDD agency in New York, our providers and our families, and the individuals with developmental disabilities themselves.
Advocates say there wasn't enough focus or resources given to their field compared to other healthcare providers like hospitals and nursing homes, especially when it comes to PPE.
We were left largely to fend for ourselves in securing PPE, and we did that at extraordinary cost and effort.
We were able to, through our provider associations, get the PPE through all channels, as everyone did in this state, through China, through wherever, and spent a huge amount of money on doing that.
Constantino believes the majority of agencies now have a 3-month stockpile in the event of a second wave, but there are still issues.
We believe that the 3-month supply will allow us to to replenish that, but to not be caught short.
We still are faced with higher costs than other healthcare providers. We do not get to leverage the ability of large healthcare hospital systems and otherwise. So we're often using the second, third, or even fourth level providers that add added cost, and quite honestly, probably not the same quality.
Senator Carlucci, who hosted the event, will be putting together a report on the information learned during the forum. In Albany, Karina Capabianca.